Hi everybody. My first non-autocross video on YouTube. Um, actually my first probably video doing something like this ever. I don't tend to even put myself in front of the camera for photos, but I am going to be making um, some videos from now on, checking in for a while, uh, making videos, talking about a few things, a few changes that are happening for me coming up here very soon. So the reason I'm going to be doing this is I have a surgery tomorrow. Sorry, my throat is a bit weird. It's been weird for a while, since about December. So excuse me. The reason that I'm going to be making videos is about 5 weeks ago, I found a lump in my throat. I'm going to see if I can show you here. It's right here. Right here, right in this kind of spot is 3.4 by 5 centimeter cyst. We know it's a cyst. When I found the lump, I called the doctor. Actually, talked to a nurse on the phone first because it's Kaiser and they have a advice hotline. Asked me some questions. Have I lost weight? I've been sweating at night, things like that, which I haven't. And then, well, I've lost weight, but it's just from like changing of diet and being quite sick in December, but not recently, at least not at that time, at the very end of January. So nothing severe. And so described what the lump was like, immediately got an appointment with a doctor and um, went to see a doctor, checked it out, made an appointment with a specialist, went the next day to see a specialist at the head and neck department of Kaiser, evaluated this lump and found out it is a cyst, did a fine needle aspiration, which is where they put a needle in and extract what's in there, and it ends up being it was fluid. So felt pretty good about that. But he said have to take it out surgically, and so that surgery is tomorrow. Unfortunately, after a CT scan of the neck and cytology of the fluid came back positive for abnormal cells, specifically papillary type cells. And so the consensus right now is that I have papillary thyroid carcinoma, which is thyroid cancer. It's not definitive, but it's very likely because those cells wouldn't be there otherwise. And so tomorrow, when they do this surgery for the cyst, they'll test the tissue part of the cyst. And within 30 minutes, they'll have a result on whether those papillary cells are in the tissue as well. And if they are, then they're going to follow through with a complete, what they call a neck dissection. Sounds pretty awesome, right? Where they'll cut down like this and around, and they'll remove the thyroid, some lymph nodes. The CT scan showed I had 5 lymph nodes on the same side as this cyst, which actually is a lymph node that's become enlarged. And it's going to remove all that if that test comes back positive, which we expect that it will. So please go to my blog. I'm going to be writing about this a lot more than I'll have video. That's joltdudeuc.blogspot.com. And please go there and read about it. I'll have 4 posts just to kind of catch up to today. And then starting tomorrow, I'm going to start blogging a lot more about what's going on. Thank you.